Good afternoon. I'm George Latimer, Westchester County Executive. It's Thursday, April 1st, and this is the second of our two reports on the Westchester coronavirus update for this week. I'm joined, as I always am, by Deputy County Executive Ken Jenkins, who will be reporting on a couple of issues for us as well. And I'm very fortunate to have Dr. Charlita Amler, who's the Commissioner of our Health Department, and Peter DeLucia, who's one of our senior managers in the Health Department as well. And they're each going to talk about different issues that affect where we are at this point in time in the pandemic. We'll try to be very straightforward on the things that we want to share with you. And we'll start, of course, with the numbers as we always do. There has definitely been a jump up in the last 48, 72 hours in the number of active cases. As of the information available on the New York State Tracker today, there are 5,914 active cases of coronavirus. That is on a basis of 120,316 year-to-date or pandemic-to-date positive cases. 114,402 was the number we had 2 weeks ago, so when we compare the difference of it, that number is 5,914. If we were going to compare over the period of time from where we were 2 months ago in January, that's still a big drop from where we were then at 11,500 cases. It is not much of a drop from where we were a month ago, and just in the last couple of days we've seen that number risen by a number of cases. The number of positive cases overnight was 584. That's a significant number. We haven't had a number quite that high in the last few weeks, and there's been some consistency with one blip on the screen, which may be attributable to the lower number of testing cases that was done on Monday into Tuesday. And so over the last 3 days, we've gone from 5,665 cases up to 5,733, now up to 5,914. The increases are not as dramatic as we saw in November when we were escalating or back in the beginning of the pandemic, but they are a cautionary note. Dr. Amler is going to address some of that. I'm going to address some of that as we go forward. But for right now, those are the numbers. The last hospitalization number we had was as of Monday, 266 people hospitalized for coronavirus. That number is a little below where we were a week ago in its peak. But again, we've oscillated a little bit. We've been above 250, below 300 now for the last couple of weeks. We had a period of time, about 7 weeks, where there was a consistent drop in the number of hospitalizations. That is not the case now, and we're kind of monitoring to see if it's a day-to-day scenario. The great question is, what are the impacts of the variants in the numbers that we're looking at? We know that we've had incidents of UK variant here in Westchester County. We have not gotten any confirmation that we've had either South African variant or the Brazilian variant, and obviously as a non-medical, non-scientific person, I couldn't begin to try to describe what the differences between them would be. We're told in general that these variants make the disease more communicable, which means more people will get it. Therefore, we're not surprised by the rising number of cases. If it is a more severe impact on the individual, that means we would get more people who are hospitalized, and then we'd also, unfortunately, have more fatalities. So we have to see what that looks like over the next 7 days and try to make judgments based on what the numbers tell us. There's always a fear that we're seeing another reignition of the concerns that we have, and so many of us are at the point of pandemic fatigue, where we don't want to wear the masks. We've done over a year of this now, and we know that there's a rising number of vaccinations, which I'll touch on in a second, and the weather's getting better, and I think we all have a desire to get back to normal. So the question at hand is, can we get back to normal, and if so, how? And if that means still extending our period of time of self-control and, if to some extent, self-denial, so that we're as sure as we can be that we're past a point of restarting the virus in a more profound way. We don't know all those things, but we give you numbers, and then we'll have some expert commentary from Dr. Amler and some others as well as part of the process. We have 2,203 fatalities throughout the course of the pandemic. The rise in deaths has been a smaller amount day by day over the last couple of weeks, low single digits, which is better than what we experienced again a few months ago, where we had double-digit increases in a given overnight situation. But every fatality, I say it every time, I have to say it, and it's the right thing to say, every fatality is not a statistic, it's a human being, and it's a serious loss of life. And it matters a lot to some people who knew the individual. And so even as we've had a reduced number of deaths, that the aggregate number is still climbing as we pass the 2,200 mark, and that is of some concern. On the vaccination side of the agenda, we're continuing to crank it at the county center. We've reached now the point of over 150,000 vaccinations given out at the county center. That does include first and second shots. So the number is not exactly correlating to the number of people overall that have satisfied the vaccination. But the county centers administered 152,000 vaccines. The Yonkers Armory site, which is also a site that can accommodate large numbers of people, is at 29,000, almost 30,000 individual vaccinations given out. And our two clinics, one of which in our traditional clinic in White Plains was open right at the outset of this vaccination distribution, and then the county community college in the gymnasium, which has opened up over a month ago and has really given us a second, much larger facility to work with. They are at, in the aggregate, 31,000 vaccinations. So if you take those four major vaccination centers together, you're at almost 215,000 vaccinations given out. That's a good number. There are 1 million people in Westchester County. The 215 does not include, or 214 does not include one shot per one person. J&J, yes, but in the other cases, that we may be including just the first shot on some individuals. So we're not quite at that magic number, but the general number we've worked with is over 15% have been fully vaccinated, and about another 15% have had at least one dose of one of the two Moderna, Pfizer doses that require double dosage. It also includes if you got one shot of Johnson & Johnson, you're considered fully vaccinated, and so that's part of the equation. Governor has opened up now the age limits, lowered them. If you're 30 years of age and older right now, you're eligible for a vaccine, and that number drops down on April 6th to 16 years of age and over. And what that basically does is wipe out all of the other eligibility categories that someone would be concerned about. In the beginning of the pandemic, we talked about what your occupation was. Were you in a public contact type of job, and that would allow you to get a vaccine no matter what your age was. If you had an underlying health issue, comorbidity, you were eligible to get a vaccine regardless of your age. These were things that happened over time. They all didn't happen day one. But we're now at a point where if you're 30 or older, regardless, you can get the shot, and by next week you'll be 16 and over. There is a parameter that says that the only vaccine that we're administering in the county health department is Moderna, which is for those 18 years of age and older. Obviously, there's some testing being done on those who are under the age of 18. Not all of the vaccines that are public are considered equally safe under that area, so we'll let the professionals at the national level make some determinations. Our clinic, any of our satellite centers that we do, we previously called them pop-ups. We think the word satellite better expresses what they are. They're temporary vaccination sites. We'll talk about one in a second. But at any of our satellites or in our two major clinics, we will be using Moderna, which is, again, a two-shot vaccination. If you're trying to register a 16 or 17-year-old on the county website, it may be difficult to do that. Once again, be persistent, as it is certainly more plentiful product now than was before, but we still do not have enough product to satisfy the demand completely. And so therefore there will be some delays and closed off situations. We're all trying to do our very best to open this up as best as we can. I want to talk specifically about the Johnson & Johnson situation. You've heard some stuff in the news. Ken will give us a little briefing on the status with the Johnson & Johnson vaccination. So Ken, if you can share that information, that would be helpful.
Thanks, George. New York State and the county are closely monitoring the concerning reports that came from a production issue at a Johnson & Johnson affiliated factory in Baltimore that may have impacted millions of doses. Things that we really want to know, I want you to know, is that New York State has said clearly, New Yorkers could rest assured that the next week's allocation will not be impacted by this at all. In fact, the facility that was making the product was not authorized at this point in time, so nothing has impacted the vaccines from Johnson & Johnson that we were getting. All appointments scheduled at state-run mass vaccination sites will be honored. So if you had a mass vaccination site from New York State, from the MI eligible website that was administering the Johnson & Johnson vaccine, or at a local pharmacy, that those doses are not impacted at all. This week, Westchester County and the Health Department, as county executives pointed out, did not receive any Johnson & Johnson vaccines for this week. And we do normally find out sometime early next week or over the weekend, and we certainly will keep everyone informed. Thanks a lot, George.
Thanks, Ken. Now, in addition to the major 4 vaccination centers that we've already discussed, the local pharmacies have vaccines. There are now a number of these temporary sites, satellite sites that are arising. New York State has established quite a few of them, and now the county is doing the same with part of the allocation of doses that we get. You may recall I reported a couple of weeks ago that we had a multiple-day county satellite site in Yorktown, and we did a 2-day satellite site in New Rochelle. We have coming up on Monday and Tuesday ahead of us, April 5th, April 6th, at the Portchester Senior Center, a county-sponsored vaccination site. That's 222 Grace Church Street. It's in the rear of the complex. If you know the area on Grace Church Street, that's Portchester Village Hall. It's also where the Ride Town offices are located. If you go around the back of that building, the senior center is an extension to that main building, and that is where the vaccinations will be given out. Vaccinations start, I believe, 9:30 in the morning, go to 5 p.m. Appointments are required. They're required in every one of these situations. You can't just show up, stand online, and get a vaccination. You must call in advance. You can call the Portchester Senior Center at 939-4975, or you can call the county at 995-2901 to make an appointment. These are Moderna shots, so see you in 4 weeks for the second shot. But that's a Portchester temporary vaccination site that's coming up Monday and Tuesday of this week ahead. In looking at the numbers and the fact that they've jumped up the last couple of days, there's a legitimate concern I think that everybody would have, which is, are we starting to see an increase in positive cases, something that's concerning to us, and what do we do? And of course, the most practical, what do we do, is to do the things that we know we should be doing, and if we have slacked off on that, then to reestablish the same level of discipline that we had before. Wear a mask, socially distance, use sanitizing for your hands to make sure you're not picking up the virus and then taking it into yourself or giving it to somebody else. As I said a while ago, it is very difficult to continue to do something that's not part of our normal lifestyle, but it's a necessity. And the 2,200 deaths that we have give you the reason if you have any questions in your mind. We know that there are a large number of people in the society that are dubious about taking the vaccination. We're not yet at the point where we have to address that reality because we don't have enough supply yet to satisfy everybody who wants a shot. But we're going to try to do that. And when we reach the point at which we've got 60% or 70% of Westchester residents vaccinated and the remaining cohort are reluctant, we will then do what we have to do to try to help get that vaccination up as close to as high a number as we can. Somewhere out there is a magic number where we get herd immunity, but that's for the scientists to interpret and deliver to us. Our job is to try to stay diligent and do what we have to do. With that thought in mind, Dr. Charlita Amler has been with us every step of the way during this. She is a pediatrician by profession, medical doctor, and she had a previous assignment in Putnam County as head of the health department there. Has been here in Westchester for quite a bit longer time and came in the prior administration as well as servicing in our administration, and we're very much reliant on her advice. We appreciate her professionalism and of a whole department, which we're going to talk of a little bit after that. We'll meet once again Pete DeLucia in a few minutes, and then we'll talk about the whole department as part of a week of celebration. But Dr. Amler's in a position to at least give us some of her opinions about what the numbers mean and what we do about those numbers. So Dr. Charlita Amler, our Commissioner of Health, thank you for being with us.
Good afternoon. So I'm pleased to be here with you today, but not too pleased about the topic. And so the county executive went over some of the numbers that we've had since we started this unfortunate outbreak. But I think it bears repeating and just taking a moment to look at where we are and where we've been and where we are right now. So if we go back to last October, we were roughly seeing about 100 cases a day. And as we approached Halloween, we were a little bit concerned, but we weren't sure that we would see that much of a bump in our numbers. Unfortunately, we did have a number of parties, Halloween parties that occurred in Westchester, and not too long after Halloween, we saw a significant bump in our number of positive cases per day. Our numbers actually went up from about 100 a day to more than 300 a day. And as most of you will probably remember, the incubation period for COVID is up to about 2 weeks, but averages around 5 to 10 days. So when we have these parties that occur, we don't see an instantaneous increase in the number of cases, but we may go on to see an increase in our caseload. So then if we look what happened in November of last year, as I said, in October, we started to see more cases after Halloween, the end of October, but then by Thanksgiving, shortly after Thanksgiving, our caseload had went up to 600 new diagnosed cases of COVID a day. So what we can tell from that is these gatherings, social gatherings, really do have an impact in the number of positive cases that we are seeing. So then we had Christmas and we had New Year's, and this January, our case count went up to over 1,000 cases a day. So again, we're back to what is the common factor that all of these situations have, and that is that we have people having gatherings in their home or attending gatherings or attending parties, and that close contact, it acts to spread the disease, and so we see significant increases in our numbers. One of the reasons we asked to be here today was we're seeing an increase in our numbers over the last week. So at the start of this month, the start of March, we had 293 cases assigned to case investigators. And as you heard the county executive say, yesterday we had 574 cases. That's almost 200 additional cases a day. And if every person just infects 2 people, you could see where those numbers would be very shortly. So I know that a lot of times we feel like there's nothing we can do about this pandemic, that we're all helpless, but that's not really the truth. Where this pandemic goes and what happens in our county is really up to each and every one of us individually. We all have responsibility for our health, and we have responsibility for those who are around us, those that we care about, those that we work with. And so we need to do our part in trying to keep the case count down. Last Saturday, we had the beginning of the Passover celebration, and this Sunday, we will have Easter celebrations in many of our homes. So I'm asking you to please remember the numbers that we've just shared with you. Remember what's happened to us over the last year, and to be very diligent and cognizant of gatherings within your home. Testing is still a great way to know your status, and testing numbers have dropped over the last few months. So if you have any concerns that you've been exposed to COVID or you're having symptoms, I would really ask you, please get tested for COVID before you go to any social gatherings, before you go to a dinner of 10 people for Easter. Know your status if you are at all concerned. Because although the current limits for us to have people in our home is no more than 10 people in our home, it only takes one COVID positive person of that 10 to spread the disease to every single person in that home. And so we really ask you to please, if you're not sure, if you're concerned, please get tested. But what else can we do? And that is we can wear a mask. And even if you have been fully vaccinated for COVID, I've been fully vaccinated for COVID. Continue to wear a mask. And the reason I ask that is that there is no vaccine, even though these vaccines are extremely safe, they're very effective, there is no vaccine that is absolutely 100%. So please continue to wear your mask, especially when you are around people that are outside of your pod, your home, your small group. Social distancing. we continue to get a lot of complaints at the health department around social distancing, people not social distancing, and I will let my assistant deputy commissioner, Pete DeLucia, talk a little bit about that in just a few minutes. And we talked about testing, but the other thing that I want to end with is vaccination. And I know some people are still very concerned about whether or not they want to get a vaccine. They're still not convinced that it's safe. I am here to tell you that vaccines are extremely safe. They are very effective. They do a lot to help us prevent this disease, and I think that's one of the reasons we're not seeing more deaths than we are, is that we've largely vaccinated our elderly population, and we're just not seeing the deaths that we were seeing just a few weeks ago. So, as I've said before, this is up to us. It's up to each of us. So I'm asking you to please help me, help the county executive, help your neighbors, help your family, to help stop the spread of this disease so that we can get to a point where we can have large gatherings and we don't have to wear a mask. And that's the goal that we're all trying to reach. Thank you.
Thank you very much. Thank you very much, Dr. Emler. Before we bring Pete DeLucia up here, I just want to go over travel advisory information. We have for many people a vacation week from school, and so there are people that are on the road in one way, shape, form, or another, and many who will be coming back into Westchester County. Quarantining and testing are no longer required for those who've been involved in domestic travel and are asymptomatic as of the beginning of today. And what does that mean? You have traveled within the 48 states of the United States, 50 states of the United States, or to our territories as well. And the territories would be Puerto Rico, Virgin Islands on this side of the globe. We have some out in the Pacific as well. The regulations are if you're traveling within the United States, 50 states and the territories, and you are asymptomatic, you're not showing symptoms of the disease, when you return, you do not require quarantining and testing. If you have traveled internationally, outside of the borders of the United States, it is still recommended, if you are not fully vaccinated or have not received from laboratory-confirmed COVID-19 during the previous 3 months. Now, that's, the current thinking in 3-month period of time. Beyond when you have been vaccinated, that number may change as we go forward and as medical science gets a better idea. But the Center for Disease Control and Prevention, the CDC, you've heard a lot about that. The restrictions on international travel are established by that entity, and the New York State travel form must be continued to be filled out by all travelers. But again, the travel restrictions have loosened so that if you do travel within the United States and its territories and you are asymptomatic and you've returned fully vaccinated, then you do not need to quarantine. And you have to be the best judge of it. You'll know, whether or not you're exhibiting the types of symptoms that could indicate that you have the disease. So let's be safe and be smart about it. Next, I'm going to ask Peter DeLucia to join us here. Peter's going to go over, as he's done, some very practical-minded advice. He was the man who showed us how to wash our hands. 66 years of living, and he had to show me how to wash my hands. Peter.
Well, thank you, George, very much. And we can wash our hands together anytime you like. Very important. As Dr. Amler so eloquently noted, a lot of the cases that we see and the bump in cases we see are after holidays and after events. And what I want to remind everybody, with Passover, underway and Easter right around the corner, the state still has gathering limits that are required at your personal residence. And that's really 10 people indoors and 25 people outdoors. And when we talk about gathering outdoors, that's not an outdoor barbecue that turns out going into your house. That would be totally outdoors. You could have a shelter, a tent with 2 sides, but that's it. It's meant to have that airflow and that circulation. And for indoors, it's just 10 people. That could be your family and your a loved one's family or another relative. But still, when we do that gathering indoors at our own home, I know we feel very comfortable. You feel comfortable in your own home. Maybe when you're outdoors, you're more apt to take the mask and put it on. But you have to remember, even if you're at home and with your loved ones, you could still transmit COVID. You could be asymptomatic. You could be vaccinated and feel like you have that comfort level. But being vaccinated is not a free pass to not wear the mask. I'm fully vaccinated also, just like Dr. Ambler. We wear our masks whenever we're in public and around anybody else. It's very important. So remember the big three when you have a home gathering: hand washing, wearing your mask, and social distancing. The only time you could really take that mask off is when you're completely alone, outside, take a mask break, or in another room, maybe in the bathroom on your own, or when you're eating. And that brings me to the next thing I want to remind everybody is, our restaurants are open, our businesses are open. Things are starting to try and spool back up, but we don't want it to happen where it's spooling back up so quickly, and our cases are going to go up with that too. So respect the businesses, respect the restaurants. They're all enforcing what we're telling them, and what the state's telling to enforce is wear a mask, socially distance, wash your hands. So remember, when you are dining out and you're taking that opportunity to go out and enjoy a restaurant, those rules are in place for a reason. So when they bring you to your table, your mask is on. When you get up from your table to go to the bathroom to wash your hands, which I want you to do, very important, put your mask on. So these are all important things. And as the weather is getting nicer, we're having sporting events and outdoor activities happening. So you're outside, you may think, no, I don't need to wear my mask. Well, if you're out on a trail and you're enjoying the parks in Westchester County, you don't have to have your mask on. Maybe have it around your neck, have it on your wrist. But then when you see somebody else walking by, you put your mask on out of respect and out of making sure we knock this disease out so we don't have any issues. When you go to your son or daughter's lacrosse game or soccer game, which is happening all throughout the county right now, people are allowed on the sidelines. You're allowed two fans per player, basically, in many scenarios, but you need to wear your mask still. That's out of respect of your neighbor and out of respect of not making anybody else sick. So those are very important things. I'll end with the Excelsior Pass now that's available. You can download that app, and once you put your information in there, it shows if you're vaccinated or if you've had a recent negative test. So you can have that right in there, and that's going to be something that a lot of venues, as they open up, are going to require you to show proof of either vaccination or a recent negative PCR test. So that's an easy way to have that and be able to provide that for that person that runs that venue to show that, everything is okay and you can actually attend that venue while still wearing your mask, social distancing, and regularly sanitizing and washing those hands. So I really want to thank our county executive, our deputy county executive, and my commissioner for having me be able to relay these important tips to you. And just please, as we would say, you don't want to spike the ball at the 5-yard line. You want to spike it in the end zone. Let's get into the end zone. Thank you.
Thank you, Peter. Thank you very much, Peter. And with both the presentations by Dr. Ambler and by Peter DeLucia, this is a perfect time to recognize National Public Health Week, which is at hand from April 5th through the 11th. It's actually going to start for the bulk of next week. It's set aside every year, and of course this year even more so, the vital work that our public health professionals do. And we have seen this us up close and personal over the course of the last year. This incredible challenge of the COVID-19 crisis has really tested everybody in the society, but the public health professionals more than anyone else, as they deal directly with all of us who have not been through a pandemic, unsure of what to do, nervous, worried, requiring additional services and to do things very differently than we have done it in the past. And it's been our public health workers and our public health professionals that have helped us guide through this situation to get to this point. This is a perfect opportunity to celebrate their sacrifice. Again, we're not on the in the end zone yet, but we have to be able to recognize how well they've done to help us throughout all of this time. Public health, like other elements of county government, are things that you don't think about. It's in the background. We have professionals that are out there testing the sanitation levels of all of our restaurants. So when you walk into a restaurant, you have a comfort level that you're going to be able to dine safely. They have individuals go out and check the quality of the water in various pools, public and private pools, to ensure that you won't get any pathogens from being in the water. We have public health professionals who do respond when we have any kind of an outbreak, food poisoning outbreak, and we've had some serious ones over the years that weren't part of COVID. And in every one of these situations, they step forward. They step forward in testing, data sharing, contact tracing, as we're well aware of, the vaccination effort, all of these things that have been very much part of the COVID-19 situation. And even as we're doing the COVID things, there are routine services, I mentioned a few of them, that have to happen day after day after day, and Dr. Amler's department's professionals continue to do that work every day, even while we try to respond to the COVID-19 crisis, which has caused, hours of additional work over on top of those things. The health professionals do something as well, probably something that I don't pay enough attention to, and that is educating and promoting healthy lifestyles. And if the best type of treatment of a disease is the preventative effort, then that's also what the health department has been very important to do. And programs that try to reduce smoking, programs that try to show healthy nutrition for pregnant women, that they show healthy nutrition for themselves and for their babies that are coming into the world. The department's website is filled with all this type of information. They have a very active Facebook page, and it's very helpful for all of us to be able to be conversant with that. The planning and evaluation staff for the department tracks and analyzes health data and develop reports. Under normal circumstances, you say, well, you develop reports, they lay on a shelf someplace. But the dashboard that we have that gives certain statistical information, which people are dying to know as much as they can, they'd like to know more. We're subject to the information that's revealed to us by the state. But putting together that data requires healthcare professionals to be able to do that. The disease control unit works with medical providers and the public to prevent the spread of communicable diseases that we seem like we're pretty familiar with. There's also services through children with special needs programs and supplemental food and nutrition education for qualified women, for infants, for children, all through the WIC program. That's part of what we have here. We have an environmental health staff that protects us from animal and insect-borne diseases like rabies and West Nile. And you can recall X number of years ago when West Nile virus manifested itself, the health department was on the front lines of that issue and tried to determine how best do we keep mosquitoes under control, how do we test them to make sure that the essentials of life, the air we breathe, the food that we eat, the water that we drink are clean or safe, and that requires us to respond to things like hazardous spills, lead inspections, various public water contaminants, and to make sure that they aren't infecting what we drink and what we eat. All of these things comes from a department that really does prioritize health equity, quality, and accessibility. And I think it's important to note that during my tenure as county executive, I basically have benefited by the very same health department that served my predecessor. That we looked at the Department of Professionals and we determined, I think rightfully so, that we let professionals do professional work and we don't put that heavy hand, that thumb into how they operate day to day. And hopefully they feel that support from those of us in senior management for the county as well. We deal with issues that are more contemporary, things such as sexually transmitted disease, tuberculosis, HIV. So it goes on, and all of these different things are laid at the doorstep of these professionals. Those of us who don't share any of those expertise, we turn sort of blankly and say, what do we do? How do we do this? How much will it cost us, and can we get this done? And they have responded time and time and time again. They've given opinions to school districts and municipal governments, as well as to other departments of county government. We are tasked with implementing the laws of New York State. We follow New York State guidance. Sometimes the guidance is clear. Sometimes the guidance is not particularly clear. And then the professionals of the county department have to determine what's the best strategy to take if things are unclear from the state level down to the federal level down. So I want to thank Dr. Amler. I want to thank First Deputy Commissioner Renee Recchia, Deputy Commissioner Peter DeLucia, and so many other professionals in the department. If I start naming them, I'm going to forget people and wind up hurting feelings rather than praising them as they so richly deserve. So thank you to all of the members of your department, Dr. Amler, your colleagues, Peter, the people that report to you, and I think the residents of Westchester owe you a great debt of gratitude. We are, I hope we're at the 5-yard line. I hope we're not at the 25-yard line, but we are where we are, and as many people as we have lost and as many lives have been affected, it would have been much worse if we all didn't try our best to do what's professional. And I freely admit every chance I get that I don't consider myself the smartest man in the room. I do consider myself a wise enough man to put other smart people in the room with us so that we can make decisions based on the best possible science and the best possible practical experience. And our health department has done that. And so therefore this week ahead is a week to recognize them, to thank them for what they've done. There'll be some other matters that we'll put out to the press as well to try to do that. I want to close by referencing that the iconic Radio City Hall Rockettes have participated in a public service announcement put together by Westchester County encouraging people to get the COVID-19 vaccine. We have a video, I believe, that will show the Rockettes making that point, I think, at our Kensico Dam Plaza. So, cue the Rockettes.
It is so nice to be at Kensico Dam in Westchester County, just to get a moment to be outside with each other. My name is Danelle Morgan. I'm a Radio City Rockette.
Hi, I'm Miranda Labar, and I am a Radio City Rockette.
Hi, I'm Caitlin Gaffney, and as a Radio City Rockette, there's nothing more important than our health, and that is why I'm getting the vaccine.
Especially as Rockettes right now, and all performers out there, we want audiences to be able to come back into theaters and see us so we can bring that joy that everyone needs right now.
It's been nice to know that we'll be able to get back into the studio by getting vaccinated and by taking care of our bodies and doing all of the social distancing that is necessary.
And now, like with all the vaccines coming out, it's almost just like more hope.
I will be getting my vaccine when it is available to me.
When it's my turn, I will definitely be getting the vaccine.
Just stay hopeful and stay healthy.
5, 6, 7, 8.
We can't wait to see audiences back at Radio City in 2021.
We want to thank the Rockettes for their participation in this public service campaign. We hope to see some of our additional athletes from the New York Knicks and the New York Rangers may join us in similar efforts in the days to come. And, you know, they are all iconic figures, well-known in the community at large, and to help us get this message out about vaccination we think is very important. With that, we're going to go to questions. We have, I believe, the first question is going to be directed to Dr. Amler. So I'm going to step away from the microphone. Catherine Chaffee, our Director of Communications, you can direct the first question to Dr. Sholita Amler.
Sure. So the first question is from Samantha Crawford for Dr. Amler. Samantha's from News 12. She asks, what is your take on the state lifting quarantine restrictions for domestic travelers as we see cases go up around the country?
Well, it's a mixed bag. And I think that basically what they're saying is that we're vaccinating more and more people, and as people are vaccinated, there may be less need for quarantine restrictions. But on the other hand, they're also putting in there that they recommend for people who are not vaccinated that they do consider quarantining themselves voluntarily. So I get it, and I understand that, you know, here in Westchester, we've got over 30% of our population with one vaccine, but a reminder that one vaccine is not fully vaccinated. To be fully vaccinated, you need to have both vaccines, unless you've got the Johnson & Johnson, and you need to have had at least 2 weeks after your 2 vaccines. And if you've had both of those and you travel, you can do relatively safely, we feel, these days. Certainly, I would continue to wear a mask, as we've talked about. I would continue to social distance. I would do all of these things. But if you haven't been vaccinated and you've traveled, and of course, remember, we cannot vaccinate children yet. So the recommendation from CDC is to consider voluntarily quarantining. I think that's good advice.
The next question is from David Proper from the Journal News. This is for the county executive. He asks, what do you think of the fiscal crisis ongoing in Mount Vernon, with the city's comptroller refusing to pay bills, and what assistance can the county offer?
Well, I think the crisis in Mount Vernon is very serious. The county has already stepped in a number of ways to help the city of Mount Vernon with the issues that have come out of these actions. We have taken over the responsibility to complete the Memorial Field project, which is a city recreational facility. We've picked up the responsibility for incentivizing development in the Industrial Development Agency IDA program. The city's IDA is not functioning at present, and so the county's IDA has stepped forward to do that. We've provided, on an emergency basis, assistance to help them clear up a sewer problem that happened a couple of weeks ago. Ken Jenkins was involved in that, as was I, and then the same in terms of this fuel crisis that we have right now. Look, I think there's a dereliction of duty on behalf of the city controller. I believe that is the case. I have no personal animus to her, but what I understand now is not acceptable. The county does not have the direct authority to take any action on these things. That remains for court action. to do this, but the citizens of Mount Vernon deserve to have their city government provide the services that they're legally required to do. And no individual, no matter what they've been elected to perform their duties, can neglect those duties and then defend that under any basis. And it's even worse than there is no public defense of the reasoning for not doing this. So I'm very straightforward about this. I think the mayor and the city council and the individuals who work for Mount Vernon government have tried very hard to deal in a situation where you have a separate source of authority. But I think it's time now for if either the individual does what they're supposed to do or superior authority comes in and requires this to be done. But we cannot have a city that cannot put police cars out on the street or fire engines out on the road. We cannot have a city that unfortunately can't contract because proper audits haven't been done. And there's no excuse for this. Zero excuse. And anybody who pushes back on that, I will push back harder. The city deserves to be able to move forward in an effective way, and if an elected official is not going to do their job, then they shouldn't be an elected official. Next question.
Okay. The next question is on the same topic. David asks, do you think Governor Cuomo should remove Deborah Reynolds from the position?
Well, I think the governor and his people are well aware of the situation. They're assessing what their options are. I never like to try to predict what someone else in public office is going to do. I think a remedy could be found through the court system. And I think that the mayor and the common council and the other officials of Mount Vernon are moving forward to do the things that they can do. The county will continue to be a partner to Mount Vernon, as we would be to any municipality. If this were happening in any village, town, or city in Westchester County, well, we don't have the authority to do certain things. We would be a good neighbor and a good friend and try to step in and help that city, that town, that village get through a crisis. But what we have now is more than just a crisis of the moment. This is a systemic problem, and it needs a systemic solution. The remedy may come from the courts, it might come from the state government, but wherever it comes from, it needs to come.
Okay, that was the last question.
Good. I want to thank David Proper from the Journal News, LoHUD, and Samantha Crawford from News 12 for those questions. Any other members of the press that have questions, they can feel free to contact Catherine Chaffee at 995-2932, and she'll be happy to try to get some information and follow up. Thank you for watching. We'll be back again on Monday at 2 o'clock for the next update. In the meantime, stay safe, and of course, over this weekend, we wish our Jewish brothers and sisters a healthy and holy completion of their Passover recognition, the last night of Passover coming up shortly. And for our Christian brothers and sisters, as we have the most solemn day on the calendar, Good Friday, followed by the most joyous day on the calendar, Easter Sunday. May all of these days for our Jewish and Christian brothers and sisters be days of blessing. And we'll see you on Monday at 2 o'clock.